Growing up as a child and adolescent is a mix of ups and downs. Imagine facing a mental health condition like anxiety along the way. It makes it more challenging. Anxiety is one of the most prevalent psychiatric disorders, affecting about 7% of children in Australia. Anxiety can impact the child, their families, the healthcare system, and society. My PhD aims to examine the economic burden of anxiety disorders experienced by children and adolescents in Australia, using data collected since 2004, by looking at health related quality of life for children and their caregivers, as well as service use and the associated costs. Policymakers can use these findings to help lessen the overall economic burden of anxiety and improve the lives of children, adolescents, and their families.